We all remember when we used to go to the doctor's office for that routine, if not a little scary, wellness checkup. But aside from the usual procedures, books are finding their way into the exam room thanks to a new program. Here's our Blaine Singletary with this story.
Physicians here at OU Children's Hospital in Oklahoma City aren't just looking out for their patients' physical well-being, but also their mind. It's all thanks to a program growing all over the country, and especially here in Oklahoma, called ROAR, Reach Out and Read. And their mission is simple.
It's very important that parents read to their children every day.
Dr. Marnie Dunlap is a physician at OU Children's Hospital, just one of 75 clinical locations throughout Oklahoma, getting books in the hands of thousands of young kids.
We know in the first 3 years of life that the majority of brain development happens, and reading aloud actually activates parts of the brain that we're now finding with MRI studies that other things may not. So we train providers, medical doctors, nurse practitioners, physician assistants on the importance of parents reading to their children every day and age-appropriate tips of how to do that with each individual child.
Basically, it makes reading part of the routine wellness checkup. When kids from 2 months to 5 years old come in, the doctor gives them a new book and tells the parents how to make it a part of their day. And this little book can actually clue the doctor in on some very important things.
I hand a 6-month-old a book. They grab the book, put it in their mouth. I already know that their gross motor skills are exactly where they should be. If I hand a 2-year-old a book that's upside down and they turn the book right side up, they open the book and they look back at their parent, I know that they're interacting appropriately, that they know which side of a book is right. And so I can do a lot of my developmental surveillance in the exam room just with a book.
And this isn't just a program for poor or sick kids. All children are included. But for those whose parents or parent might not be able to afford a book, ROAR can get them on the right track, and perhaps even break the poverty cycle. Lori Lake is the state director for ROAR.
The ability to read is very, very important to being successful as an adult. And so if we can give those children the skills at a young age that they can build on at an older age, then they're going to develop those literacy skills. They're going to enter middle school being able to read. They're going to graduate from high school. There'll probably be greater chances of them going on to college.
And we're not talking about tablets. Lake tells us you just don't get the same kind of benefits from videos or ebooks.
First of all, you're, I think, enhancing the bonding experience. You're sitting there with the child and maybe on your lap, maybe on the couch, but you're sitting there together and you're sharing. And so by doing that, you're talking, the child is responding, facial expressions, cooing, commenting, asking questions, and then you're responding to that child. That just isn't able to be replaced.
And it's that back and forth interaction that's really at the heart of this, and why it's important to read to children, even as infants. Again, Marnie Dunlap.
Most people don't think necessarily about reading to a newborn, but that's when their brains are like sponges. So they're learning, everything in their environment, and reading and vocabulary and words, even talking and singing to young kids. All of those are important things to stimulate their brain.
With 10 new Oklahoma clinics signing on in just the past few months, doctors and parents are clearly seeing the benefits. And the kids are buying in too.
The other day I had a little baby that I've seen forever, and he was about 13 months, but I was getting ready to leave the room and he kind of reaches out to me and goes, "Book." Mom didn't even know he knew that word at that time, but he associated, he'd come to clinic, he'd already gotten 3 books, and that was what he was supposed to get when he came to the doctor.
From helping parents bond with their little ones to laying a foundation for their future, this little book can make a big difference. Again, Lori Lake.
By addressing reading at a really young age, or literacy at a really young age, we are making, I think, a difference in our society, because we're improving the future of those children who maybe wouldn't have had the advantages otherwise.